Hello everyone, I am John, VP of Technology Solution at OSP Labs. Welcome to our very first episode of the Digital Health Podcast. Last year, over several webinars, we explored various aspects of digital health. Today, we will kickstart our podcast series by discussing the growth of telehealth and telemedicine within digital health. The COVID pandemic exposed our healthcare system's fragility, so healthcare organizations began looking for more technology solutions to serve their patients while safeguarding their staff and continue reducing cost and improving productivity. So now, telehealth and telemedicine are not just buzzwords, but real life-changing healthcare experiences. They offer features like availability, cost-effectiveness, reimbursement policies, patient outcome, cloud solutions, and technologies to capture information live, which is called synchronous, or store and forward, called asynchronous. This and the continued improvement of biosensors and wearable devices is increasing the adoption of telehealth solutions. Did you know that the number of physicians reporting telehealth as a skill increased nearly 40% from 2019 to 2020? And not just providers, but patients also seem to be loving telemedicine services. A 2020 report by Doximity shows that since the COVID-19 pandemic began, the number of Americans who joined one or more telemedicine visits increased by 57%. So, let's look at 10 of the fastest growing subset of telemedicine in radiology, cardiology, dentistry, dermatology, pathology, family medicine, psychiatry, pediatric, urology, and ophthalmology and optometry. Okay, number one, teleradiology. Teleradiology is one of the top telemedicine specialties, which when combined with AI, customized 3D imaging, enhanced mobility and cloud solution, is one of the most competitive and fragmented market. Millions of CT scans, X-rays, and MRIs are done every day across the globe. The need for early detection, timely intervention, and prevention surgery with improved diagnosis and management of cancer have led to increased demand for CT scans over other radiodiagnostic techniques. By adopting teleradiology and syncing to health information cloud systems, transmissions of radiological patient images from one location to another is possible. This is great for the purposes of quick, expect diagnosis that can save lives and for sharing studies with other radiologists and physicians. This branch of medicine provides an opportunity for radiologists to analyze the photos collected by distant AR teams. In rural areas, this is extremely useful. Enhanced productivity and workflow efficiencies are the key benefits of teleradiology. The second subset of telemedicine is telecardiology. Heart disease is the leading cause of death, not just in our country, but in the entire world. Clearly, better prediction and early detection can help doctors treat patients before they become seriously ill. With telecardiology, healthcare providers transmit electrocardiographic data remotely in real time for interpretation by a specialist. Teleconsultation reduces follow-up visits and is also beneficial for critically ill cardiac patients who can now opt for home-based telehealth nursing. In cardiac patients, remote monitoring of arrhythmia and vital signs tends to improve quality of life and decreases the chance of hospitalization. COVID pandemic has raised the demand for telemonitoring of cardiac patients to provide better healthcare outcomes. Now, in TeleDentistry, the American Dental Association reported that 85% of people recognize the importance of dental health, and yet, almost 42% of people do not visit the dentist enough. Hopefully, teledentistry will lead to better patient-provider communication and improve patients' overall oral health. In the future, Skillful integration of teledentistry can create fruitful growth of family dentistry, because family dentists may act as guides for specialized services, facilitating the dental care offered by other dental telemedicine specialties. Teledentistry will also enable rural, aging, and medical population to access quality dental services. As for people who fear visiting a dentist, the painless digital consultation will take the telehealth and telemedicine market by storm. An interesting new area of interest is the link between oral health and cardiac conditions. I'm sure we'll learn more about that in the future. Another subset of telemedicine is teledermatology. The most common cancer in the US, skin cancer, is diagnosed in more than 9,500 Americans every single day. Teledermatology helps dermatologists diagnose, monitor, treat, prevent, research, and educate virtually, especially for patients in inaccessible and faraway areas. Dermatologists, primary care physicians, and telehealth nursing teams get to know more about the aesthetic procedures through teleconferencing, both real-time or store and forward, and this enables skills acquisition. As the cosmetic craze is on the rise, teledermatology is rapidly becoming a demanding telemedicine specialty because very few specialists are presently available in the domain of aesthetic surgical procedure compared to the dermatology population and the increasing knowledge and demand of clients for aesthetic beauty. And then there is telepathology. Telepathology allows analyzing the electronically transferred digital images instead of specimen slides from microscopes, contributing to one of the revolutionizing benefits of telemedicine. Telepathology also greatly benefits pathology in trainings and education, primary histopathology diagnosis, frozen section analysis, second opinion diagnostic procedure, and more. Adopting telehealth and telemedicine solutions in pathology will not only be cost and time saving, but massively accelerate the early diagnosis of many diseases, as well as rapid pathological examination and prompt intervention. Next on my list is family telemedicine. The multiple benefits include easy access to telemedicine specialists, reduced chances of catching the new disease, quick access to a doctor in case of seasonal flu, allergy, vomiting, or diarrhea, and streamlined chronic illness management of family members, which will reduce the burden of caregivers too. Family medicine is an on-demand telemedicine specialty that allows you to consult your family doctor with a single click. With teleconferencing and virtual patient monitoring features, the telehealth family doctors and nurses will be able to manage the flow of patients in a much better way. Telepsychiatry is also seeing a considerable rise in adoption among provider and patients. People with mental health issues require careful attention, support, and continuous monitoring to prevent the worsening of their condition. Telepsychiatry aims to provide mental health services that are credible, easy, and readily available. Psychiatrists were assisted by the American Psychiatric Association to provide this service for improved patient outcomes and support. HHS exempted HIPAA fines for using non-HIPAA compliant video conferencing technology during the COVID-19 pandemic, as COVID mental issues were on the rise, thereby increasing demand. State license requirements have also been relaxed, so that patients can now access all interstate telemental health and psychiatry telemedicine providers. People with mental health problems are more likely to exhibit dangerous behavioral changes, and telepsychiatry can help to mitigate the sense of isolation for patients who need continual assessment. And telemedicine for psychiatry services, including telenursing and telemonitoring, can be provided in highly dangerous areas that are not suitable to residential medical practitioners, such as military troops, submarines, or even international space stations. Telenursing and telemedicine for psychiatry will enable video and text therapy, improving patient engagement, with proper prescription management and monitoring of behavioral health and improvement in patient health outcomes in less time and less cost is now possible. We've worked on such a project which also included claims eligibility, scheduling, and payment gateway. Telehealth is also used in pediatric care, which can improve the lives of many children across the world. Telemedicine in pediatric practice reduces the need for in-person for some appointment. For caregivers, it eliminates stress and absenteeism expenses, and for children, it reduces time lost in missing classes or school. Telehealth can also be used for at-risk pregnancy. We worked on such a project to provide MFM specialists with live video and ultrasound imagery of babies taken by lab techs in rural areas and less serviced areas. Urology telemedicine is another telemedicine specialty that is making waves. Recent research published in European Urology found that many urological patients have health risks for unfavorable COVID-19 outcomes, and most of the patients preferred telehealth consultations. By adopting telemedicine, urologists can provide remote clinical support, reducing unnecessary visits and the risk of COVID-19. This also enhances automatic assistance and is much more cost-effective. The AI-enabled telehealth diagnostic technology helps doctors and urologists understand and determine early signs and symptoms of various urological diseases. There will be no need for extended hospital stay for the post-operative care of the patients. And Bluetooth-enabled biosensors and wearable devices will further assist urology telehealth visits for revolutionized healthcare delivery. Regarding biosensors for remote patient monitoring, we can and have worked with manufacturers to add abilities for monitoring, tracking vital signs, alert medical staff, and even remind patients of their prescriptions, diet, and exercise schedules using both synchronous and asynchronous methods. And lastly, I think ophthalmology telemedicine and optometry telemedicine are starting to get widely adopted by providers and patients. Ophthalmology and optometry telemedicine help minimize patient exposure via on-demand digital treatment by communicating with patients where they are. The right patients can be linked to the right provider at the right time with a virtual ophthalmology care solution. Ophthalmology professionals highly prefer to view telemedicine as the asynchronous store and forward technique used to screen for diabetic retinopathy. Telemedicine system can also be of great help during seasonal or destructive displacement like flooding, earthquake, frost, hurricanes, and cyclones. Ophthalmology telemedicine will play a key role in avoiding irreversible vision damage. It can help ensure that patients with undiagnosed eye disorders are identified early and get timely treatment. In conclusion, that's it, folks. These are the 10 telemedicine specialties that I see growing in leaps and bounds and having the power to transform the healthcare market while being cost-effective to both healthcare insurance providers and patients. With the advancement of digital technologies within telemedicine specialties, medical care is shifting towards a new frontier to create an improved and streamlined healthcare delivery system. The major benefits of telemedicine is the ability to approach healthcare specialists that you would not be able to reach easily. Telemedicine solutions provide huge healthcare job opportunities while empowering staff with the needed resources to view a patient's record and their present medical conditions safely and responsibly. If you have any questions for me or OSP Labs, please feel free to contact us via our website at osplabs.com. And lastly, in our next podcast, we plan to discuss best practices for creating an effective telehealth strategy. Thank you. Have a wonderful day.